RFK Jr.'s new vaccine panel to meet and consider childhood immunizations. An influential vaccine advisory committee that's members were recently replaced by Health and Human Services Secretary Robert F. Kennedy Jr. is set to meet and review common childhood immunizations, potentially deciding to delay, loosen, or remove recommendations for routine shots. According to the meeting agenda, the Advisory Committee on Immunization Practices on Thursday and Friday will review the measles, mumps, rubella and varicella vaccine, the hepatitis B vaccine, and the COVID-19 vaccine. The meeting comes just a day after Susan Menares, ousted director of the Centers for Disease Control and Prevention, testified before a Senate Health Committee. Menares said she was fired because she wouldn't agree to Kennedy's directive to approve every recommendation from the Advisory Committee, regardless of the scientific evidence. She also testified that Kennedy said he plans to change the childhood vaccine schedule. The question before us is whether we will keep faith with our children and grandchildren, ensuring they remain safe from the diseases we fought so hard to defeat: polio, measles, diphtheria, whooping cough, and many others, Menares said. Undoing that progress would not only be reckless, it would betray every family that trusts us to protect their health. Here's what to know about the committee and the vaccines in question. The Advisory Committee's role. The committee's role is to provide recommendations to both the CDC Director and the Secretary of Health and Human Services on the use of vaccines to control vaccine-preventable diseases in the U.S. population. Typically, states use the recommendations to form their required school entry vaccine policies. Insurance companies also cover CDC-recommended vaccines, and healthcare facilities have them readily available. Removing a vaccine from the list may reduce supply and end insurance coverage, making it harder and more costly to get vaccinated. Infectious disease physician Dr. Wilbur Chen, endowed professor at the University of Maryland School of Medicine, said the committee's decisions have the ability to impact public health throughout the U.S. New ACIP recommendations could cause confusion at the provider level, lack of easy access to vaccines, and it may mean that families, individuals, parents are somehow being swayed by the discussion to become more and more hesitant and refuse to get vaccinated, he said. When you have vaccines not being taken up in a population, that is the opportunity for infectious diseases to rise and to cause the consequences that we are trying to avoid with these vaccines. Advisory Committee members. Kennedy announced in June that he was removing all 17 members of the committee and replacing them with his own picks. A clean sweep is necessary to re-establish public confidence in vaccine science. ACIP's new members will prioritize public health and evidence-based medicine. The committee will no longer function as a rubber stamp for industry profit-taking agendas, he said in a statement. He appointed 8 new committee members, one of whom withdrew. At the time, the new committee included only 1 epidemiologist and 1 infectious disease specialist. It did not include a virologist or immunologist, specialties typically associated with vaccine experts. In fact, a quarter of the new appointees weren't medical doctors, and half didn't appear to have published vaccine-related papers in a peer-reviewed biomedical journal, according to Science. The abrupt change was roundly criticized in the medical community. A letter signed by nearly 100 professional medical organizations, including the American Medical Association and the American Academy of Pediatrics, urged Kennedy to consider the ramifications of his overhaul. Removing a panel of independent experts appointed through a transparent, public nomination process and selected for their expertise on this issue will undoubtedly seek to sow further doubt and cause growing confusion among healthcare professionals and their patients, leading to additional increases in potentially serious illness among our patients, the letter said. On Monday, the Health and Human Services Department announced that 5 additional members would join the advisory committee, several of whom have records of criticizing vaccine policy. They include an epidemiology professor who publicly questioned the seriousness of COVID-19, an OB/GYN, a pharmacist and podcaster, a pediatric cardiologist and pastor accused of spreading misinformation, and a transplant surgeon. Chen, a former member of the committee from 2020 to 24, questioned the expertise of the members on the current panel. These decisions are being made by a group of people who normally would be bona fide subject matter experts. If you're going to fly a rocket to Mars, you would probably want to have astronauts and engineers in rocket science as part of the meeting members, he said. But you're having, other people that are basically selected for other reasons that are not related to subject matter expertise. That should be a concern for all Americans, that any important decision-making is being made by people who are not subject matter experts. Hepatitis B vaccines. The first dose of the hepatitis B vaccine is currently recommended for newborns in the U.S. The 3-shot series is the best way to prevent serious liver disease caused by the hepatitis B virus, according to the CDC. The committee members are reportedly considering delaying the initial dose of the vaccine until age 4, a delay Chen says is unnecessary. Hepatitis B can be a chronic infection that infects you for life and gives you a much higher chance of liver cancer and liver failure, he said. Vaccination should be as early on in life as possible because you can get it even from mother to child transfer. Delaying birth doses would give a window of vulnerability to babies that are being born and are not being protected. At the committee's June meeting, Kennedy's new committee chairman, Martin Kulldorff, suggested delaying the vaccine for babies whose mother is not hepatitis B positive. Kennedy proposed instead of a vaccine, pregnant women could be tested for the virus. Measles, mumps, rubella and varicella vaccine. The MMRV vaccine protects against 4 viral diseases: measles, mumps, rubella and varicella, commonly known as chickenpox. It is typically given to children in 2 doses, with the first between 12 and 15 months and the second between 4 and 6 years old, according to the CDC. The review of the vaccine comes as the nation contends with the highest number of measles cases in decades, overwhelmingly driven by occurrences in unvaccinated people. Data from the CDC released Wednesday said there are 1,491 confirmed measles cases this year, 92% of which were in unvaccinated individuals. That number is up from 285 confirmed cases in 2024. COVID-19 vaccines. The Food and Drug Administration approved in August the next round of COVID-19 vaccines, but limited eligibility to people who are 65 or older and at risk for serious complications or have other health problems. The CDC also removed in May the COVID-19 vaccine from its list of recommended shots for children and pregnant women. The Washington Post reported last week that the Trump administration planned to link the COVID-19 vaccine to the deaths of 25 children, a misleading statistic that has alarmed medical professionals. The committee could make a different recommendation than the FDA and CDC, or it could continue Kennedy's goal of reducing use of the COVID-19 vaccine.